Almost any problem becomes more manageable if you have a framework for understanding it. This is true of suicide prevention as well. And the only thing better than a framework is having a framework that you share with other people you work with in your community. Hi, I'm Tony Pisani, and the organizers of this conference invited me to speak with you for a few minutes about the Suicide Prevention Framework and Learning Program that's available to you and your teams across mental health and primary health care, thanks to support from the New South Wales Ministry of Health, the Central Coast LHD, and your PHN. First, I'd like to acknowledge the traditional custodians of the land on which I'm speaking. That's the Seneca people of Western New York, as well as those of the land where you're meeting. We pay our respects to their elders, past, present, future, and emerging, and the elders from other communities who may be here today. I also acknowledge all people who have personal experience of mental illness, suicide concerns, and suicide loss, which I know includes many of us here today. Lived experience is essential to our work and to the goal of suicide prevention. I believe you've already met Mel Clark, who's there with you today, family advocate of SafeSide Australia, who brings the experience of a family carer, as well as years of experience advocating for youth and families in Hunter, New England region. But in a moment, you'll hear from Christina Mossgraber, who's a lived experience faculty member at SafeSide and a very close collaborator in all of our programs. What's happening at your conference today is truly remarkable. Dedicated professionals from your LHD across psychiatry, psychology, social work, and other mental health disciplines meeting together with dedicated primary care and allied health professionals, along with peer workers and community advocates. Interaction among diverse professionals is not only rich and right from a personal and human perspective, it's absolutely critical for suicide prevention. And that's highly consistent with the conclusions that Christine Morgan, the National Suicide Prevention Advisor, came to in her final advice to government, just released 2 weeks ago. So I'd like to give a special appreciation to the GPs who are here today, eager to play their role. Because people who are struggling with suicide concerns are not split into the silos the way our health systems sometimes are. And if they come forward with their concerns, wherever they come forward, all of us have an obligation to give them the best practices the field has to offer. But working together across sectors of the healthcare system is easier said than done. I founded SafeSide to assist health systems and regions achieve greater unity in health and mental health workforce. We accomplish this through complementary programs for mental health and primary care that share a common framework for recovery-oriented suicide prevention. Here's an overview of the framework. SafeSide's programs center around the SafeSide framework for recovery-oriented suicide prevention. This framework is a map of best practices in suicide prevention that gives individuals, teams, organizations, and even entire regions a common language and consistent structure for suicide prevention. The framework is organized in 4 core tasks: connect, assess, respond, and extend.
Connect, asking directly about suicide and the person's story and experience. The goal is to collaborate for safety and more than safety, towards recovery and well-being.
Assess involves gathering and synthesizing information with the purpose of understanding the person's experience and informing person-specific preventive actions. Respond covers those person-specific actions, plans, and resources for the person at risk as well as others in their lives. This includes how to work as a team to provide the best care and document that care.
Extend. For the people you serve, most of life happens when they aren't with you. Extending the impact of your care beyond the individual and beyond your setting can help you feel more confident that the responses and plans you develop together will hold up when unexpected stressors arise.
Of course, we haven't figured it all out, and it's never going to be easy. But at least you have a map, and one that you share. We know that those who are here at this conference want to lead efforts to improve the care for those you serve across the LHD and throughout the PHN. And we're hoping that the SafeSide framework can fuel a next phase of improvement through the synergies created by a shared framework, a common language, a common roadmap that helps to close gaps in care, facilitate warm handovers between services, and extend care into people's support networks. Now, SafeSide's approach to training, which we call in-place learning, is a workforce education model born out of research that's sustainable, easy to implement, and built for teams to complete together. Think of it as online learning you do as a group. Take a look. The framework is taught through in-place learning, an approach that blends online learning with live connection and interaction. In-place includes 3 components: the in-place workshop, our community of practice and office hours, and refreshers and updates.
In-place workshop is a video-guided group experience. Think of it as online modules your team completes together, instead of by yourself. So you have the benefits of online learning, convenient, repeatable, and the benefits of live group interaction, a shared experience. Tony and I, and other faculty, teach core concepts and skills in suicide prevention with the help of demonstration videos. These videos show real care professionals, with actors playing youth and adults expressing suicidal thoughts. Discussions and practice exercises are interwoven to help groups talk through how to apply the skills within their specific context with those that they serve.
In your account, there's a download that walks you through getting started with in-place learning and hosting a workshop.
You and the group will be prompted to complete an online evaluation. You'll see a prompt and timer on the screen. Ensure you and the group complete this important step. It certifies you completed the workshop. You'll receive a certificate, and then each person will be prompted to create their own SafeSide account using their work email.
Our community of practice is our online forum where you can ask questions and get resources anytime, anywhere. Through your SafeSide account, you'll have access to us and others using the SafeSide framework. In addition to the online community, you can participate in live, regularly scheduled office hours where you can ask questions and share your experiences with our team and others using SafeSide in their work. We schedule multiple sessions each month, so you're sure to find at least one in your time zone. Remember, if people in your workshop have questions, you don't need to have an answer. Simply honour the question and encourage them to ask it in the community of practice or bring it to office hours.
And that brings us to updates and refreshers. Once you have a SafeSide account, you have access to the videos from the in-place learning workshop. So you can go back and refresh on your own or with your team anytime. We update the workshops regularly based on emerging best practices and feedback, so you'll always have the most recent version. We also post quick, self-paced opportunities to keep learning and growing with us and others. These learnings are aimed to help keep you positive and refreshed as you're doing this important work.
I understand that the conference hosts will have the SafeSide primary care program available during the conference today, so you can take a moment to experience this video-guided workshop firsthand. So to summarize, SafeSide provides a common framework and language for best practices across a system or region. In-place learning is a flexible, sustainable, social approach to learning and getting the support you need to apply it to your work. And all of this is towards a vision of united health and mental health workforce. Christina expresses this vision better than I can. Here she is.
The dream we have at SafeSide is expressed in the final element of our framework for recovery-oriented suicide prevention, a consistent approach across system and community. The dream is that no matter where a person interacts with health and human services, they will find teams, systems, and teams across systems that are on the same page with suicide prevention, engaging with common language, best practices, and deep commitment to recovery. A diverse workforce in diverse locations with diverse populations united around a common set of life-affirming principles and practices.
Thank you, Christina. And thanks to all of you for your work to protect and enhance the lives of those you serve. And finally, would you please join me in thanking the organizers of this conference, in particular Esther Soul, the Suicide Prevention Manager at Central Coast LHD, and Dan Reynolds, who's the Commissioning Coordinator for Mental Health and Suicide Prevention in the PHN. Esther and Dan, thank you for your vision of cross-system unity towards zero suicides in care.